Can we start? Good morning, everyone. Good morning. It's always exciting to start these meetings. This is the one meeting that we always look forward to in our diaries, and it's such a wonderful meeting because we get to connect with friends, we get to connect with amazing people that do brilliant work. I've just come back from a meeting. My friend Lukoye invited me to a meeting in Nairobi, where he taught me a few things about hospitality. So in Nairobi, we started every morning with a song and dance before we started the meeting, and we had a group of people that sang. What's the famous song about Jambo? Jambo. Luckily, I can't sing, so I'm not going to sing that to you. But I think it might be wonderful maybe to get people to stand up a little bit. So I've been told that we have colleagues from all over the world. And so maybe this is a good time for us to stand up and just, if I read out your region, if you can stand up, please, and just wave and say Jambo. And then we will say, what's the Swahili word for welcome? Karibu. Yeah. So I've been told that there are some West Africans in the group. I know there's Sierra Leoneans, Ghanaians. Can you stand up and just welcome? Fantastic. Welcome. Welcome to the mother city. There are definitely some Kenyans, East Africans. Are there any Ethiopians? Can you welcome? Yeah. I see you've poached one of our South African psychiatrists to be East African as well. Thanks, Neil. And then, of course, there's some people from the Southern Africa. There's some Zimbabweans at the back. There's some South Africans. Can the South Africans also please stand up? Yeah. Wonderful. And then we have people from North America. Are there any Americans in the room? Don't be shy. Yeah. And we also might have some people from the United Kingdom in the room. I don't know if, can you stand up, please? Thank you. So welcome, everyone. Welcome to Africa. Welcome to the motherland for some people. Welcome to the mother city for us who live here. And we know that, this city in particular and our continent in general is a land of contrasts. In this city, it's very clear when you're here that there are people that have a lot of money and there are people that have very little money. I'm sure when you drive in from the Cape Town International Airport, you'll see on the one side that there are shacks that have very little space, very little green spaces, and there are people on the other side of the highway that have vast amounts of green land. So those are some of the discussions that we'll be having today, which our theme is about. And I think it's a wonderful place for us to do this because there are definite wonderful examples of these contrasts just outside our door. So my name is Bonga Chiliza. I'm the chair of the Department of Psychiatry, or head of Department of Psychiatry at UKZN, and the director of the Global Mental Health. And I'll be doing this session this morning with Michelle Durham, who's a child psychiatrist from the US, who's going to introduce herself and to the team. And so we've been meeting every year now for a number of years, and this is fantastic that we have another meeting this year. The theme of this conference is the impact of climate change and what its impact on mental health. And so I think it was very apt that we started with an excursion yesterday. Some were lucky enough to go to an excursion where there was a real practical example of what can be done to try and help reverse the damages of climate change. John Parker is here, and we went to visit him and his colleagues' project at Lentegé Hospital yesterday. So we'll be chatting more about that, but I think it's a fantastic example of what you can do with limited resources, right? So why I liked it was because it's not a private hospital, it's not it's not for rich people, it's a government hospital, and yet they were able to do some really important work, and we're looking forward to listening a little bit more of that, John, from you later this morning. We also, it's a wonderful time to get to that because we also want to celebrate, and we have some wins that we can celebrate this year. There's been some people that have been promoted to associate professors from our group. I don't think I haven't seen Lebo Pashadira. It was recently promoted to associate professor from Stellenbosch University, which I think is fantastic. Saida Paruk, is Saida here yet? No. From UKZN was also promoted in the last year to associate professor. We encourage our young people to go abroad and learn wonderful skills and come back. And so we're quite excited that a young Dr. Lunga Shabalala is currently in Boston on a Fulbright fellowship and was spending some time with Dave Henderson and other people in his department, and is coming back to hopefully implement what she's learned. And we also have in our midst someone who just come back from the NIMH, did a postdoc there. Olivia, are you here? There she is. So Dr. Machavane has come back to South Africa and has joined the Department of Psychiatry at Stellenbosch University, and we always celebrate people coming back and saying no to staying on at the NIMH and rather coming back to the continent. We also, last week, I also went to Botswana, and it was wonderful because we're celebrating the first group of residents that have completed their training in Botswana by the medical school there. So those of you who are not aware, Botswana has been sending people outside of the country to go get training, specialized in psychiatry. And so 4 years ago, Philip Opondo and colleagues, they started a psychiatry training program. And so we were there to try and celebrate that. And it's wonderful because all those 6 young psychiatrists are now going to be working there, and they're unlikely to leave the country. Research has shown us that if you train in your country, you're much more likely to stay. So we're looking forward to more programs. I know that Malawi also started their training in Malawi in collaboration with University of Cape Town, so we're also looking forward to that. And there's been some people that have graduated for PhDs from our department at UKZN. We've got a couple of PhDs from Nigerian psychiatrist who's working in Botswana, and a Kenyan psychiatrist, Dr. Kiburu, who's now been poached by Lukoya Atoli. She's now a psychiatrist at Aga Khan University in Nairobi, which is wonderful and fantastic. So I think it's going to be a wonderful conference, and I think we're looking forward to Michelle to tell us about the lay of the land. But this week, I was also reminded, I guess, it's good to be reminded these things. I know these things, but one of the things that I learned in the conference in Nairobi this week is that language matters. So they were telling us that that if you speak to young people in countries and you ask them about mental health, what's your mental health like? They apparently are very coy and don't want to talk about it. But if you say, what's your brain health like? Apparently they pick up and say, yeah, actually my cognition, it's starting about memory, about how to work things out. So maybe we should be in the business of brain health as opposed to mental health. But we can discuss that. I think even our acronym HMHI is also the one that has come under a lot of spotlight about whether we shouldn't be looking at a better acronym for that. But we are excited to be here, and the next 2 days is going to be hopefully wonderful discussions, interactions. And I want to encourage particularly all the young people that are here to say that this is your forum, your time to talk and engage. Please, we want to hear your voices. We want to hear questions from you. And we look forward to discussing how we can help improve the mental health of people in Africa. And hopefully, I think there are people here that work from the bench to bedside, people that work from the neuron to the neighborhoods. And so let's network when it's time to network, and let's have a wonderful 2 days. Can I please ask Michelle, my co-moderator, to come and welcome you this morning? Thanks, Michelle.
Good morning, everyone. It's really good to be back with everyone and see a lot of familiar faces in the room and not on Zoom, so it's always good to be in everyone's company and back here on the continent as well. I'm Michelle Durham, as Bonga mentioned. I am a child and adolescent psychiatrist. I'm practicing in Houston, Texas, and have an adjunct faculty appointment at Boston University, as well as the University of Houston these days. I'm going to start with talking a little bit, just really setting the landscape for what we're going to do over the 2 days. And I think every year I say the same thing, that this is really a time to network, collaborate, think about ways that we go beyond, this meeting to do the work of thinking about mental health across the diaspora. So it's not this one-time meeting over these 2 days, but it's really how do we foster the collaborations that many of us have already made over the last few years as we come to these meetings, but beyond that. One of the ways to do that is thinking about our resource hub. And in your booklet in particular, on that last page, you'll see more information on how to get involved in the AGMHI, but also how to access a lot of the resources that AGMHI has to offer. I'm going to be probably highlighting that a few times over the course of our time together, because I really want people to go to the website, to look at what we're doing, to get involved, and not to only get whoever's next to you involved, but people in your networks, in your home countries, in the institutions you come from or where you work. So please go to that resource hub. You have access, once you become a member, have access to educational and program development materials, to workshops, to discussion boards, newsletters, there's a listserv, and so there's lots of ways to get involved beyond our 2 days together. I also just want to highlight a couple things in your conference booklet. Another thing is that with the leadership of Dr. Leila Asmal, we now have a research mentorship pilot program. And there are mentees here today, research mentees, that will be paired with research mentors, and they'll have a lunch. And it's really been spearheaded by the research work group. I know Dr. Asmal will talk a little bit about that later and highlight that when we talk a little bit about the AGMHI working groups. But I wanted to make sure you see their bios, which are on page 15 in the conference booklet, so that you know who they are in the room, that you go and talk to them, meet them, network, collaborate. The next thing is just thinking about the conference, the schedule, and what we're going to be doing together over the next couple of days. I realize I'm not following the slides, and so Sanite's probably in the back getting upset with me, but that's okay. And so the other thing I want to say is just over the next 2 days, we're going to have lots of speakers, but I think we've also tried to listen to you all. I don't know if we do a good job of that every year, but you also want to just talk and have discussions and do some Q&A, and so hopefully we've made some time for that. There'll be panel discussions tomorrow, which I think will help facilitate some of that discussion, but we'll have a keynote this morning and a keynote tomorrow that I think we're all looking forward to as well. And there will be highlighting emerging researchers. This is a thing that we started last year that has really been, I think, phenomenal and really invigorated, I think, all of us in the room to think about people that are doing fantastic research on the continent, and we're sponsoring them to come here to the conference to really highlight the work that they're doing in their respective areas along the diaspora. And so the emerging researchers will be presenting, and I think that we'll get a lot of information about what they're doing, and how you can help maybe expand some of the work they're doing in their home country. Last but not least, I want to talk a little bit about just housekeeping. And so many of you may or may not be staying at this hotel, but we do have a Wi-Fi password. So it's the Marriott Conference, but then it'll be capital M, capital C, RYS 123. If I went too fast, there's outside where you checked in, there's also a picture that you can just take a picture of it, and so you'll have it for you for the next 2 days in the conference. For those on social media, we would love for you to talk a little bit about what we're doing over the next 2 days. And so we have an event hashtag, AGMHI 2023, for anything you post. Outside the doors and to the right are the restrooms, in case you need to go to the restroom at any point during the meeting. And then we'll break for lunch as well, and there'll be lunch right outside these doors when we get to that point. Thanks for your attention this morning. Excited to kick off the day. I'm going to ask Bonga to come back up as